Hi guys. So I'm gonna continue to talk about abnormal bleeding, but I'm gonna target two age groups. Okay, so I'm gonna be talking about the adolescent and young adults. So imagine this: your little sister, your daughter, who is between the ages of 12 and 19, 19 years old, comes to you and tells you that my period is so heavy. I'm bleeding a lot. I cannot keep up. I have to use a lot of pads. So right away, this could be an abnormal problem and it should be addressed. There's no reason why this young adult should be dealing with that. But before we just start managing, again, like I said before, it does warrant a workup. I would probably say one of the best things to get for someone who's in that age group is to try to get an ultrasound just to rule out the possibility of any structural problems with the uterus. Especially in 12 to 19 years old, as they are developing, there could be an abnormal development of the uterus, and that's what leads to the abnormal bleeding. However, having said that, the most common reason is because in the 12 to 19 years old, the hormonal axis, as we call it, and the reason we call it an axis because it goes from the area in the brain that's called the hypothalamus to the pituitary to the ovaries. So this axis has not fully developed yet. So their hormones are not fully regulated, and that's why they can bleed so abnormally. So first we get an ultrasound to make sure that there are no structural problems, and then if the ultrasound is completely normal, then we have to try to help this adolescent regulate her hormones until she gets old enough where her system is going to regulate it itself. And one of the best ways that you can do that is actually by starting them on birth control pills. Yes, birth control pills. They are one of the best ways to help manage and regulate the menstrual cycle. Of course, I do give my adolescent patients a disclaimer, and I tell them we're using the birth control pills to help regulate your menstrual cycle. It's going to protect you from the heavy bleeding. But if you are going to be sexually active, then it's not going to protect you from sexually transmitted diseases and other problems that can come with that. So they definitely have to make sure that they're being extra cautious. The birth control will protect against pregnancy and regulate the menstrual cycle, but not STDs. So starting them on birth control, even at a young age, is not going to disrupt their hormonal balance as they grow. And as a matter of fact, it's going to help them regulate it. And then somewhere between 18, 19, I would say stop the birth control and let's see if their system have matured enough to where it can carry them through the rest of adulthood. And pretty much the same thing applies for the young adults. However, and this is, I'm talking about ages between 20 to about 34, 35 years old. Most of the time, it's a hormonal problem. Thyroid problems, polycystic ovary, or what's known as PCOS, or just simply a disruption or dysregulation of the hormones can contribute and lead to the abnormal bleeding. So where in the younger adults, in the adolescents, I would probably not be so concerned with a hormonal workup. In this age group, I would probably do a hormonal workup in addition to the ultrasound. And then if both are normal, if the thyroid levels are normal, if the I don't suspect the presence of a polycystic ovary syndrome, and the ultrasound is normal, then I would say your hormones are just not regulating themselves. I'm sorry. Just like an air conditioner, you set a thermostat and it tells it when to work, when not to work, when to turn on, when to turn off. You do have a thermostat that really sets your ovarian function. And if you just happen to be not one of these regular people, Not everyone's built to be a 28-day cycle. Some people are programmed a little bit different. But again, if you are one of those people, there's no reason for you to just sit there and unfortunately suffer with the bleeding. Starting on or getting on a birth control regimen, and that could be in the form of pills, that could be in the form of a patch, that could be a hormonal IUD, that could be the NuvaRing. Any of these options that are gonna considered birth control options preventing pregnancy will help regulate the menstrual cycle. Statistically speaking, we know that 35% of women who use birth control, any form of a birth control, they don't use it because they want to prevent pregnancy or prevent pregnancy only. They use it because they want to either help regulate the menstrual cycle, decrease the pain of a menstrual cycle, and decrease the amount of bleeding. So not so much of sometimes people are bleeding for 9 to 10 days, they want to bring it down to 5. They are bleeding 5 to 7 days, but they're bleeding very heavy. And using a form of birth control help regulate and decrease the amount of bleeding. So again, any of these options would be helpful. Birth control pills, for the most part, they don't affect your fertility. This is a very common misconception that a lot of women think that if I use birth control or if I have used birth control for a long time, then my ovaries could be shut down for too long and then I may have a problem getting pregnant in the future. And that is absolutely not true. We know that with most birth control pills, as soon as you stop them, your fertility resumes shortly after that. So don't be afraid to try it out. If your period is a problem, if your bleeding is a problem, please contact your doctor or your provider and ask for a workup first, like always, and then ask what options you have. And you can try more than one of these forms and see which one fits for you. No one glove fits all hands. Some people may be comfortable with the pills and they're okay with it. Some people don't want to take something every day, so they prefer to have the patch, which is you change it once a week. Some women like to use the NuvaRing. They insert it vaginally, keeps it there for 3 weeks, and then changing it at the end of the 3 weeks. Or someone who doesn't want to think about it at all may choose to have a hormonal IUD, which can sit there inside the uterus and help control bleeding for up to 8 years. So I hope you find this information helpful. And my next video, I'm going to be talking about a different age group, and that would be the 35 to 50 and then menopause. So I'll see you soon.